Thank you so much for joining us to learn a little bit about how to get started and make the most out of your benefits. My name is Denise, and I'll be taking you through today's overview. Now, I do want to let you know that this is a high-level overview. This will include most all of your value-added benefits, which may or may not be included on some of the plans. Our group plans and CalPERS plans vary from our individual Medicare plans, so you'll always want to check your evidence of coverage to make sure that the benefits are included as we present them today. So with that being said, let's see, we're going to go through a little bit about Western Health Advantage, what makes us different than some of the others, how you can best get started quickly with Western Health in accessing your care, how you can best use and get the most out of your plan benefits, and then we'll go ahead and address questions at the end. This will not take a full hour, so we want to leave plenty time for questions and address those at the end. Now, some of the information we're going to talk about, you probably have received already, but if not, please use the chat feature to ask us your questions or let us know if you need additional information sent to you. My name is Denise Grudin. I'm the Medicare Sales Executive with Western Health Advantage. All right, so if you're new to Western Health or you haven't heard of Western Health Advantage, I just want to let you know that we've been caring for our communities for over 2 decades. And that being said, within that time, we've built strong relationships with some highly regarded networks of physicians and hospitals. And with that, we're able to deliver the quality care that you deserve. Now, we are a local nonprofit company, and we truly do believe that the patient comes first. And what we do is 90% of all premiums received actually go back to our providers for your care. Now, we have a very simple approach. We believe that patients should control their health care. Now, we give you a multitude of doctors and hospitals to choose from, and we leave the plan details to Western Health while the patient care is left up to the doctors. We believe that you should make your care decisions between you and your doctor, not the insurance company. So, how do you get started? The first thing you want to do is look at your ID card. You should have received this in the mail, but if you haven't, let us know right away and we'll make sure you get one mailed out to you. It is small, it comes in an envelope with some other information. It could be easy to miss, so if you haven't received your card, please let us know right away. But once you do, or if you have it already, please check it out. Make sure your name is correct, your medical group that you chose is correct, and your primary care is correct. If you have any questions, please call our member service number on the back of your card or at this phone number listed here on the screen. Then you'll want to make sure you're on the lookout for the brochure. It's your Welcome to Western Health Advantage brochure. This is a great document that it's very, it's not that big. It's just a few pages, but it's full of information on extra tools and resources for you and how you can use your benefits. It's got the phone numbers and web address and emails for the different partners for your various benefits such as dental and hearing aids and so on. So make sure you've received that. If not, we can actually email that to you. Send your, it's a message in the chat button if you have not received this or would like to receive one, and we'll go ahead and email it to you after the presentation today. If you haven't already done so, you'll want to go to MyWA and register or create an account at the MyCare login. It's mycare.org/MyCareLogin. Your login to the portal is basically your gateway to all your information. Once you're in, You can look up documents, look up claims, choose a different provider, look for specialists, even check out your drug, see if it's on our formulary. There's a wealth of information on the portal, and again, that is your gateway to all your information that you need on your plan. Now you want to schedule an appointment with your provider. If you're a new patient or you have a new doctor, it's very important that you set this new patient appointment. Number one, it could be a little bit to get in, but once you get in, it's essential that you establish a relationship with your primary care, and so that they have your medical history, know what your needs are, and also they are the ones that you will talk to if you need to have a referral to a specialist. If you have a primary care that's already in our network, and so you're just transitioning to Medicare, it's important that you update your information, your member information, with the front office so they have your Medicare ID. You also can talk to your primary care's office in transferring any referrals that are existing or prescriptions so that it's an easy transition and you don't have any hassles with that. Some people come and they're already in physical therapy or some other continuous service through a specialist, and you'll actually need a new referral with your Medicare. So, accessing care. So, your doctor visits, you can go to a regular office visit and pay your copay, or you can also access your provider through telehealth, which is a virtual care visit. Now, most all of Western Health's doctors and providers offer the telehealth, but it does vary. So we encourage you to check with your provider's office to see if they offer telehealth and if they have any specific hours of operations for basic care services. This is a convenient service that you can see and talk to your doctor from the comfort of your own home, and the copay is the same as if you had a walk-in visit. You also have access to our nurse advice line. This is terrific because if it's in the middle of the night or you have a question or a concern and you're not sure if you want to bother your doctor yet, or you can't get a hold of your doctor for some reason, you can call the nurse line and have a confidential conversation right with a registered nurse, and they can help you assess what your next steps might be or if you need additional care. This is a 24/7 service, and it is free to all of our members. The phone number is listed in your brochure. It's also at the top of this presentation, I believe. Yeah. I've used the nurse line myself. Okay. Oh, there we go. So what if an urgent care comes up, an urgent care situation? Let's say you're too hurt to make it to the doctor or an urgent care, or you have an urgent situation. You need to talk to a doctor now. You can utilize the teledoc services, which is different than the telehealth. This is for urgent care situations. You'll be connected directly with an urgent care doctor, and they can assess your situation. This feature can also be downloaded on your app, by onto your app, your phone app or your computer app. It's available anytime, anywhere. And again, this is for urgent situations such as minor injuries or illnesses. Behavioral health. Our provider for behavioral health is Optum. Optum providers are flexible. You have your options of in-office or virtual visits, and the copay is the same as an office visit. Again, it seems like the world's moving to virtual, but it's not something that it's optional. So at least we still have a choice, right? You have a choice of seeing your doctor in person or over the telehealth services. And if you had a situation that was somewhat more pressing, a crisis type situation, there is a phone number you can call 24 hours a day to get the help you immediately need, and there's no cost for that. There's also no provider referral required for behavioral health services. Now, if you join us tomorrow, if you've registered for tomorrow's webinar, we're going to have our partners from Optum do the whole presentation just on behavioral health. So if you have any questions, you definitely want to join us tomorrow for that webinar. Go to the events registration site, which we'll go over at the end of this presentation as well. So Advantage Referral. If you're new or you've not used this service before, you're in for a treat because you're special. This is a very exclusive product, a benefit I should say, for Western Health Advantage members. This gives you access to specialists all throughout our network. So let's say you needed some type of surgery, say orthopedic, and you have a doctor that's in Napa, that's your primary care doctor, but you want to see the specialist who's in a different medical group in Sacramento, but still in Western Health Network. All you need to do is make sure that that specialist is part of the Advantage referral, which is easy to do, and then ask your provider, your primary care provider, for a referral. You have to get a referral to a specialist in order for your services to be covered, but it gives you the freedom to move throughout our network and see any specialist with just a referral from your provider. Again, this is one of the ways Western Health is different because we stay out of that decision. The decision is between you, your doctor, and the medical group. Transition of care. Now, if you've been receiving any care from any non-participating clinical providers, you may be able to continue seeing that doctor if you meet Western Health's transition of care requirements. It's pretty simple. You can just call Western Health Member Services or download the form from our site and fill it out to determine your eligibility for continuation of care through that non-network clinical provider. Prescription medication. We switched to Optum Rx in January this year, and we're thrilled because it offers you a lot more flexibility and benefits as far as your prescription drugs come. Now, you have the option of retail pharmacies or to receive deeper discounts if you use our mail order. Say you have medications that you take on a regular basis, it'd be cost efficient for you to use the mail order every 90 days, for 90-day supply, and it gives you somewhat of a discount. We also use Optum as our specialty pharmacy. Now, if you have existing mail order prescriptions and you need to transition those, Optum can help you do that easily and seamlessly. The mail order prescriptions phone number is right here, or you can visit our Optum Rx and get the medications mailed, refilled to you, just by changing it over the phone. There's no hassle here. It's not a big feat to get this switched over. Our prescription drug webinar is going to be in March. This will be a good one. Oh, all of them are great to attend, but this specifically, it'll help guide you through the website on how to best narrow down your medications right down to which pharmacies within your location and the pricing, at each one of those locations. Our network does include 6 medical groups. Let's see, Hill Physician in Sacramento, Mercy Medical is in Sacramento, Sacramento, we've got all the Dignity, it's Mercy of Sacramento, Mercy San Juan, Mercy Folsom, and also the Methodist, Mercy Methodist. Meritage Foundation Medical Group is in Marin. North Bay Health is in Solano. And up in Napa, Sonoma, and Humboldt, you've got Providence and Sonoma Napa, also Meritage. And then in YOLO is the Dignity Woodland Clinic. Within our network, you'll have 15 hospitals throughout Northern California. As you see here in Solano is the North Bay Medical in Fairfield, North Bay Vaca Valley Hospital in Vacaville, and Sacramento is the Dignity Health Sacramento, Folsom, and Carmichael, as well as Methodist Hospital in Sacramento. In YOLO, we have Woodland Memorial Hospital. Napa is Providence Queen of the Valley. And in Sonoma County, you have Healdsburg District Hospital, Petaluma Valley Hospital, Providence, Santa Rosa, and Sonoma Valley Hospital. Up there in Marin, you have Marin Health Medical Center, and in Humboldt is the Redwood Memorial Hospital and St. Joseph's Hospital of Eureka. Now let's get into your value-added benefits. You can also access this by going to mywa.org/mycarebenefits. And again, I want to reiterate that plans vary. So what we're going to show you today, you want to make sure that you check your evidence of coverage and make sure that the benefits we're going over specifically are included in your plan or have the same offerings within the plan. Okay? Dental. So our dental is offered through Delta. It's the Delta Care USA. And this dental, it offers comprehensive benefits through one of our largest provider networks. These dental plans are HMO, so you're going to be within a network of doctors. Make sure you check for the provider that you're looking for. If they're not in the provider directory, just go ahead and call Delta and see if they've recently been added. Those change all the time, as with provider networks on the medical side. They're adding doctors all the time. So it's not, what you see today, 30 days from now could be different. The coverage varies by plan, as I said, so that I say the MyCare group plans and CalPERS, you'll want to check your evidence of coverage. This specifically, the Delta Care USA is for individual Medicare Advantage plans. True hearing. Now, I'm going to tell you about these hearing aids. I want you to come to this webinar as well. There's so much that I could take the whole hour talking about the hearing aids here, but from what I know, they're nothing short of miniature computers for you. They have sound adjusting when you walk from a noisy environment to a quiet environment and vice versa. These are simply amazing hearing aids. And with the True Hearing as our partner, you're getting top quality hearing aids for a copay of $6.99 for the standard hearing aid or $9.99 for the premium model. If you have a non-rechargeable version, you will also receive up to 80 free batteries. Post-discharge meal delivery. This is an awesome program. If you are admitted to the hospital and then you discharge from the hospital, even if it's after one day, or a rehabilitation center, you have up to a maximum of 56 meals available to you after each discharge. This is terrific because whether you just had surgery and you just don't feel like cooking, or you need somebody to cook for you, or you need specific dietary food prepared, this is a wonderful program. These meals are super delicious, and I can tell you this because when they launched this program, at some of our meetings, they were able to provide some of these meals, and they're just, they're terrific. So it's nothing like, getting the Jell-O in the hospital. These are very healthy, bountiful meals. So, so check it out. I invite you to go to the Mom's Meals website and check out all the different types of foods, menus, and items you can have delivered right to your home. Vision care. Another exciting change that Western Health made, we switched our eye exam and vision hardware provider to iMed this year. Now, what this does for our members is it allows you to see your doctor and medical group for your regular eye routine, checkup for a $25 copay. Or now you can also visit, or in lieu of your doctor, visit an iMed center and have a zero copay for that same exam. The choice is yours, but you still have a $100 allowance for routine eyewear, such as contact lens, eyeglass frames, or eyeglass lens. And this is every 2 years. But that $100 is stretched further with iMed. There is a percentage based on your plan that gives you an additional percentage off of anything over that $100 and a 40% discount on a second pair of glasses. So check it out. Check out your benefits and your EOC and at the iMed website, or visit the MyCare Vision, mywha.org, MyCare Vision. Over-the-counter benefits. I just used this. My husband's on Medicare. We have the over-the-counter benefit, and it's terrific. With this over-the-counter benefit, our members have a $50 per quarter allowance to spend on anything non-prescription. So think of anything you could buy at a drugstore that is non-prescription, and you can use your $50 credit on that per quarter. Things like toothpaste, vitamins, pain relief, and more. With Optum Personal Care, which is our partner, these benefits cannot roll over to the next quarter, so you'll want to use it the whole thing. Even if you stock up or share it with your family, use the whole thing in one order, because I also believe that there's a one order limitation, which means whatever you spend is what you get. You need to spend the $50, and I encourage you to do that. It's pretty easy to do, but there's a lot of choice in there. So alternative medicine. If you prefer alternative medicine over traditional medicine for some of your aches and pains or headaches or backaches, our plans offer the chiropractic and acupuncture through Landmark Health. Now, members have up to 20 combined visits per year, and there's no referral needed. When you go to the Western Health Medicare website and search for provider, off to the right, you'll have an option for acupuncture and chiro. And just look for providers as well, and they'll find one that's, within your neighborhood. The fitness program. Our Silver and Fitness program gives you access to locations all over Northern California. And these are name brand. This is California Fitness, 24-hour fitness, family fitness, and many boutique, gives you name brand and boutique facilities that you can go do your workouts. Plus, you'll have the option of up to 1,500 at-home video workouts or online and be part of a community. They just added a whole bunch, so I really encourage you to come to this webinar as well. If you just go to the list and come to every one of them, I'm sure you'll think that it's worth it, because you'll get to know in detail what each benefit offers you. It's like your phone. You don't use half of what you don't understand. So, you've got all these apps and you don't know what to do with them. This will help you understand what to do with your benefits. Wellness assessment. So we're big on wellness, health and wellness. And with the WHA Wellness Program, it's offered through Healthy Roads from the American Specialty Health folks. And you can take a personal health assessment, which will assist you in setting your personal goals. Then it gives you access to helpful health content and a member of the community in the online community, which will help you to, encourage you to meet those goals with 100% support. And there's a lot of things you can do in there that are specific to you. You can tailor this. There's coaches that will help you tailor your program, whatever it is you're trying to accomplish, whether it's lose weight, stop smoking, eat better, exercise, and help you set goals that are achievable. There's nothing better than crossing something off your list, right? So in-home support, this is one of my favorite benefits. And the reason it's one of my favorites is because, this everybody needs a buddy, right? The in-home support is offered through Papa Pals, and you do not need to be medically impaired in any way or debilitated. Just as a member, as a Western Health Medicare Advantage member, you have this benefit, which provides a companion. Whether you need somebody to come over and do household chores, take you to the doctor once a week, do your shopping, cook your meals, play cards with you, or set up your computer. Papa Pals allows 60 hours per year. There's no charge for this. Your plan includes 60 hours. And if you break that down, that's an hour and 15 minutes per week, or 2.5 hours every other week. And there's a lot of things I could think I could use help with for 2.5 hours biweekly. Say you have family coming over, you want to get the house cleaned and a meal cooked, you could do that. Or, like I said, just somebody to walk and talk with. Travel assistance. This is another exclusive benefit for Western Health members. Now, with our travel, Assist America is what it's called. And it's exclusive, as I said, to Western Health members. It provides you with valuable resources if you travel 100 miles or more away from home. So that could be Southern California or Italy. Take your pick. I think I'd choose Italy. But in any case, if you're away from home over 100 miles, they can assist you with lost or forgotten medication or help you make it to a hospital or provider if there's a medical emergency. They'll even help you find your lost luggage or give you directions to the best restaurant in town. And if you're traveling abroad, if you need for some reason to replace your passport or make it to the nearest embassy, they can help you with that as well. It's an easily downloadable app on your phone, and you have it all right there at one touch. There's a one-touch command center. Disease management. Western Health Advantage added a lot of disease management programs this year. We've already had quite a few, but I really want to call them out for you. A lot of us have chronic conditions that we deal with on a daily basis, and our disease management program is wonderful. In fact, some of them are working towards reversing conditions that previously might not have been. But the disease management program helps you with conditions such as your COPD, diabetes, heart failure, things like this. And through the support and education with the individual MyCare plans, we also have the Insulin Saver program. So if you have diabetes, you're not going to pay more than $35 copay regardless of where you're at in the coverage for prescription drug. So pretty much all the insulin on our formulary is covered under the Senior Savers program. And it's usually often less than $35, but you're protected. So, like I said, I really want you to join us for the additional Let's Talk Benefits webinars that are coming up. This was just an overview. And if I went too fast or somebody missed something, just let me know. I can go back over it. We've got some time. I just wanted to get you familiar with Western Health Advantage and some of the places and steps you can take to start using your benefits, because they're all part of your plan. and there's no reason you shouldn't start using them and take full advantage of it to help you in your needs. We'll go ahead and take some questions. Eric, do you see any questions?
I do, Denise. The first question we have is it says, do I need to wait till I see my provider to request my prescription by mail?
No, not at all. Let me take that back. What was the question?
Do I need to wait till I see my provider to request my prescription by mail?
Okay, so I'll answer it this way. If this is a new prescription, then yes, you need to call your provider's office, let them know you need to refill your prescription, and you need it sent to the Optum for mail order service. If your prescription's already with the mail order service, Optum, and it's just to be refilled, it just depends if there is a refill in place. Otherwise, yeah, you'll have to get a new refill request from your provider. So I hope that answered your question.
Yeah, that's the only question, Denise, I saw in the Q&A session.
Oh, okay. Well, I hope that means it was because everybody was very, could hear everything that we were saying, and I hope it helped everyone. What I will say on this prescription drug question, you can also, if you need prescriptions right away and you haven't been able to get in to see your provider and you're brand new, call the medical group. They have nurse practitioners and liaisons that can help you get in right away to get your prescriptions filled. So just keep that in mind. Okay?
That's a good point. That's a good point.
Yeah, I just really wanted to call that out because sometimes it's frustrating when you're brand new to a network. It might take 2-3 weeks before you can get in to see the doctor if you're a new patient, but you need your prescriptions now. So we just helped someone. They were able to get in the next day, see somebody, get their prescriptions, and they still have their appointment set up for 3 weeks later. So
good.
Just keep that in mind. Yeah.
Okay. And, a question I just thought of actually for the group is the teledoc. There was a telehealth copay as if you were going in person to see your doctor, but for teledoc, is there a same copay as the urgent care $25 copay?
No, actually teledoc for urgent care, I believe it's $35, but yes, okay. It is the same copay as if you were to walk into an urgent care center.
Okay, thank you for clarifying. Okay, it looks like we have another one here. Okay, no, that's just the person asked the question. Thanking you for your response.
Thank you very much. Well, we really hope to see you all on the specific webinars. Again, tomorrow is our behavioral health, and then that'll be followed by, I'm not sure, I don't have the schedule in front of me, but I think next week we're doing a True Hearing, and then Papa Pal's, and our Silver and Fit. Definitely check out Silver and Fit. There's a lot of exciting stuff there. And you get 2 free fitness kits per year.
Yeah, it looks like I looked it up. So January 30th, tomorrow's Optum, and then the 6th of February is True Hearing. February 23rd is Papa Pal's. Silver and Fit is on February 29th.
Great. And then we have our schedule for March as well.
Right.
But they're already filling up, folks. So make sure, the beauty of virtual is that we can take as many that want to show up, I believe. I don't think we can break Zoom, right. But let's not push it. So go ahead and register, and we'll be happy to see you. I'm going to go ahead and leave this up here for a minute so you can take our information. So if you have questions, just let me know. And I also wanted to make sure everybody received their welcome book. If you haven't, let us know, and we'll go ahead and email you one, okay? Okay. Well, I want to thank you for your time today. Did we get everything, Eric? Just one quick swoop.
It looks like we did. Yeah, I don't see any other questions or anything of that nature.
Great. Thank you so much for joining us. As always, we appreciate you and want to do the best we can do to help you receive the care you deserve. Thank you, everyone.